mo is hypersensitive or hyperreactive. Maybe asthma, for that matter, no? Maybe asthma, maybe allergic asthma, maybe asthma from inborn childhood asthma. So, normally ganun. So, we have the pre and post. So, you will see here, there's a post and there's a pre. Pero screening lang kasi tayo, we cannot do the post. So, we just do the pre-test. When you have the pre-test, you look at, the first thing you have to look at is yung ratio. Yung ratio ng air that comes out of your lung the first 1 second. Ito yung unang buga. First 1 second, how much air did you exhale? Over the total capacity of your lung. How much air went inside your lung? On forced expiration, hindi siya normal na paghinga. Kundi pag pipilitin mong hihinga to the full capacity, yun yung kailangan natin po ng volume. Pag dinivide mo yon, there is a magic number which is 70%. Below 70%, we will call it obstructive lung disease. At under the obstructive lung disease, dalawa, asthma, at saka disease of the smokers, which is the COPD or chronic obstructive pulmonary disease, na nandoon yung emphysema, kung familiar kayo, or chronic bronchitis, kung familiar kayo, nandoon yun sa COPD. So, dalawa lang yun. That's the first one, the ratio. Second is, we look at FEF 2575. Yung FEF 2575 reflects yung mga maliliit na airways in the lungs. Yung maliliit. So, parang okay yung malalaki, pero habang kumukonti ang air towards the end, yung hirap na hirap ka nang tigain ang lungs mo, towards the end, how does your lung react? Okay, normally, if you look at the graph, normally, ano yan, ang slope niya is just continuous. So, talagang triangle siya halos. So, that means, as you exhale, an equal constant amount or an equal amount in ratio comes out of your lung. So, talagang straight siya. Now, look at her. I'll show them. Look at her PFP. So, kung ang normal, assuming ang normal dapat is itong gray zone. Triangle, di ba? Triangle. So, yung gray. Triangle yan. Let's look at that. Sa kanya, okay yung unang buga. Kulang ng konti, no? Pero okay pa din. Pero habang lumiliit ang lung, towards the end of expiration, and this is the FEF 2575, towards the end, bumabagal ang paglabas ng hangin. That means, if you will imagine a pipe that's partially, kunwari barado ng konti, di ba? Habang pinipiga mo yung hangin doon, bumabagal kasi may nag-obstruct. So, lumiliit yung kalibre. That means, kahit napilitin mo, habang pinipilit mo, lalong sumisikip. So, that's why, humahaba yung part ng exhalation mo. So, kung dapat, dito tapos ka na dapat, ideally, by predicted, no? Based on age, based on your lung function, dapat dito tapos ka na huminga, pero ikaw, ang haba pa. Kasi habang ang pinipilit mo, lalong sumisikip. That's the reason why yung mga asthmatic, habang napapagod, kunwari nag-exercise sila, napapagod, or ubo sila ng ubo, mas nahihirapan silang huminga. Because yun yung time na, ang bilis-bilis na ng paghinga mo, nagre-react yung maliliit na airways. So, ito yung tinitignan ng pangatlo. So, you have the ratio, you have the FEF 2575, is a magic number, about siguro 70 pa din, no? Below that, or below, that you know na meron siya. So, after looking at that, you look at the graph. Normally, hindi kasi nire-report yung graph. In official results, hindi nire-report yung graph. But dapat, kung mababa ito, ire-report na this is possibly obstructive lung disease, and if you look at the graph, it agrees with the numbers. Okay? That's it. Sometimes naman, normal ang numbers. Pero pag titignan mo to, bumabagal na siya. Then you will say, the numbers are okay. Pero I would look at the graph, and habang kumukonti ang air, and habang pinipilit kong lumabas ang air, bumabagal ang labas ng hangin. So it is suggestive of small airway obstruction, and that's usually seen in patients with asthma. So ito yung nakikita namin. So pag nakita yan, bibigyan kayo ng gamot, wait for 15 minutes, let the medicine work, and then they do the test again. kung nag-normal yan, assuming ginawa, and after 15 minutes, ito, naging triangle na perfect. Naging ganyan siya, from the tip to the end. That means nag-improve ka.
So you have asthma.
That means that proves, that confirms that you have asthma. And if nag-resolve siya, kunwari 100% improvement, that's really asthma. Kung nag-improve, ng konting-konti lang, that's probably COPD. Kasi in COPD, or the disease of the smokers, we do not expect complete reversal with just the Ventolin alone. With just one medicine. That's the difference. Ang COPD kasi, which is the disease of the smokers, alam natin that it is progressive. Alam natin na kahit na naggagamot na yung pasyente, yung lung function nila, meaning the amount of air that goes in and out, hindi nababago. No? As opposed to an asthmatic, totally nagre-reverse. So, an asthmatic person can live a very normal life. While a COPDer, once may COPD na sila, and depende sa symptoms and depende sa severity, they will remain in a way, parang may konting difference or limitation in function. So, yun yung ano doon, yun yung difference nila. Kaya, ang importante is that dapat sa buong Pilipinas, available yung spirometry natin. Kasi ito lang yung way para malaman natin kung maaga pa yung COPD, malalaan ba yung COPD natin, kung asthma ba siya, pwede bang magamot, nare-reverse ba, how effective are the medications. Years before, we would always say that COPD hindi nare-reverse. Na ibig sabihin, kahit na anong gamot na ibibigay natin, the goal is only to make the patient feel better. For that, para maganda yung quality ng life niya. Habang buhay, maganda yung quality.
Symptoms, pero it's there na.
Nababawasan. Hindi nga na-alleviate kasi nababawasan yung symptoms. We will tell them that although with medication, kung asthma ka, kung nandito yung level of activity mo, ito yung baseline mo, with medication, ma-reach natin yan. With COPD, even with medication, maglayo ka pa din sa normal. Yung level of activity mo will always be above, a lot of steps away from the normal. It starts with as mild as pag-akyat sa hagdan, hindi na kayang umakyat ng second and third floor, humihinto sa gitna, magpapahinga ng konti, tapos after that, pwede na, that's mild. Second, eventually, pag lumalala siya, yung patag, yung flat, naglalakad lang siya ng ganon. After a few meters, medyo hingal na. Okay. So that means medyo nag-i-increase yung severity, di ba? Ang pinakamalala, and that affects quality of life and that causes depression for the patients, is when they're simply eating or simply taking a bath. The basic